Sudden cardiac arrest is a life-threatening condition. Patient will be unconscious and not breathing. When we do a sudden cardiac arrest, we need to follow the resuscitation action plan. You'll otherwise know it as the DRSABCD. So look for dangers. There are many dangers around any first aid site, including a sudden cardiac arrest. We need to check if the patient's responsive. Hello, shake and shout, can you hear me? Is there any response from them? If they're unconscious, dial 000 and get your paramedics on the way. Remember, we all need help, so you'll need to get paramedic help, and you do that by dialing 000 anywhere in Australia. Then open the airway. Remember, we need to clear the airway or make sure that the airway is clear. We need to make sure that they're not actually choking on any foreign bodies in their airway. Once you've checked the airway is clear, move on to assess their breathing. So are they breathing? Look, listen and feel. So look for the rise and fall of their chest, listen to see if you can hear any breathing coming out of their mouth, and feel their chest to see if you can feel any movement. Especially if people have clothing on, it might be a bit difficult to see the chest moving, so get your hands there and physically feel whether their chest is moving or not. If they're not breathing, and we've established now that they're unconscious and not breathing, then we need to begin immediately cardiac compressions, CPR on the chest at about 100 to 120 per minute. Now remember, get your defibrillator that's close by as well, and get a defibrillator onto your patient as soon as you can. And when you're doing your compressions, the defibrillator will actually have a metronome, a beeping sound that will guide you through doing your compressions. The defibrillator will advise when it's about to shock. If you have a fully automatic defibrillator, it will automatically deliver the shocks, or there may be a button that you have to push on a semi-automatic mode. Remember, keep going, swap over operators, that's CPR operators, at every 2-minute interval that the machine tells you to stop, and utilise bystanders, family members, colleagues, etc. to help you. Send people out the front to wait for the paramedics, and make sure that you make it as easy for your help to find you as you possibly can. How long do you keep going with CPR? You keep going as long as you physically can, or until your professional help arrives. If the patient wakes up or appears to wake up, roll them onto their side into the recovery position, leave the defibrillator pads on there in case they go back into sudden cardiac arrest, in which case the defibrillator will pick that up. But otherwise, roll them on their side, comfort them, put a blanket over them if you have one, and wait for the paramedics to arrive.